We've all had headaches that come and go, but then there are those who deal with chronic headaches that just won't go away. Dr. Rudy Gari from the Florida Pain Relief Group joins us now to help us get rid of them. And Dr. Gari, this is perfect timing because I've had a headache for the past 4 days. So what's the difference between a regular headache and a chronic headache?
Well, the key term, Cindy, is called chronic. So chronic means anything that lasts longer than what it should.
What should it last? Like a couple of hours?
Maybe an hour or two. Anything more than that, if you get them frequent, so you can have irregular chronic headaches, you can have regular chronic headaches. There's all kinds of different nomenclature for headaches. It has to do with the type of headaches that you get and also the duration and the treatment for it.
Well, let's talk about what can cause these chronic headaches, because I need to know.
So chronic headaches can be caused by different factors. The underlying factor is the fact that when we get headaches, it's essentially some sort of irritation in your brain. And it's usually vascular. It's usually something your blood vessel either dilates or constricts, and it causes sort of an inflammatory process in those vessels. And there's nerves that are associated around those blood vessels that gives you that pulsating type of headache. That pulsating that you're feeling is actually the pulse of your vessels. And that can be aggravated by tension, stress. Sometimes,
check.
Sometimes people just are just predisposed to that. Just anything. Sometimes lights. Any activity can cause headaches to come on, stay there, and stay a lot longer. Sinus infections. I mean, all kinds of things can cause and make those headaches worse.
Right. Are there some people that are more prone to these chronic headaches? Is there some underlying factor going on?
There's usually some sort of, there are certain types of headaches that are predisposed, that are inherited, because we know that genes in your genetic makeup can predispose you to certain types of headaches.
Really?
So, a family history of chronic headaches usually leads to someone else also having a chronic headache.
And if you have chronic headaches, you know that popping pills is not going to give you much relief because it's just going to come back the next day. So what can you do to help somebody who's going through this?
Well, one of the things that people maybe don't know about, and I see them on a regular basis, is something that's called hyperalgesic headaches. And what that is, you can actually get headaches from taking too many pain pills.
Oh.
So it has what's called a paradoxical effect, meaning the opposite effect. So sometimes I'll have patients that'll come in and they're taking like massive quantities of morphine and other very, highly potent medications, and they have chronic headaches. And what I tell them is, we're going to have to place you in what I call a drug holiday, meaning that we'll have to switch you over to a different type of medication and let your body reset itself. Your headaches actually get better by reducing that amount of medication that you're taking.
And if somebody's got a tension headache, can you help them with that?
Tension headaches, we can definitely help them, and you have to work at all the cause of the tension. Usually maybe there's a lot of anxiety, so so we tell them to have a good, healthy lifestyle.
Right.
Sometimes the patients are depressed, sometimes they need something for anxiety, and then inflammation or just the pain itself.
Right, so you get to the source of the matter and fix it from there.
Absolutely.
Good stuff. Dr. Gari, thank you very much. You can visit their website. It is floridapainreliefgroup.com and schedule your same-day appointment. Get relief right now or give them a call at 844-KICK-PAIN. Dr. Gari, thank you again.
Pleasure.
We'll be right back.